Hi everyone, it's me again, Pinky Lopez Bautista from Bachelor of Science, Business Administration, major in Financial Management. In this video, I will continue the second part of my home-based advocacy entitled COVID-19 in Health Protocols. In this second part of my video, you will know the different protocols on how to reduce coronavirus. But before that, let us watch the short COVID-19 safety reminders. The best way to prevent spreading the disease is to avoid being exposed to the virus. Here are the top 10 ways you can help reduce the spread of COVID-19. Number 1. Get the COVID-19 vaccine. If you are eligible, COVID-19 vaccination is safe, effective, and free. The vaccine benefits anyone who gets it and is especially important for people who have an increased risk of developing severe illness from COVID-19, such as older adults and people of any age with certain medical conditions, including pregnancy. Number 2. Wash your hands with soap and water for at least 20 seconds after any activity. This includes blowing your nose, coughing, etc. Always wash your hands before eating or cooking. If soap and water are not available, use an alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth with unwashed hands. Number 3. Wear a face mask or face covering. If you are not fully vaccinated and 2 or older, you should wear a face mask that covers your nose and mouth in indoor public places. A cloth face covering may not protect the wearer, but it may keep the wearer from spreading the virus to others. To reduce the spread of COVID-19, the CDC recommends that people in areas with high numbers of COVID-19 cases consider wearing a face mask in a crowded outdoor settings for activities with close contact with others who are not fully vaccinated or in a situation where social distancing measures are difficult to maintain. Number 4. Maintain social distancing. Work from home if possible and avoid crowds and poorly ventilated indoor spaces. Keep at least 6 feet between yourself and others who don't live with you. Avoid social touching. This includes shaking hands, kissing or hugging. Instead, try a hand wave or a smile. Number 5. Clean high-touch surfaces regularly. Clean and disinfect frequently. Touch objects and surfaces like tables, doorknobs, light switches, desks, phones, keyboards, toilets, faucets, and sinks with household disinfectants that are appropriate for the surfaces. Number 6. Cover cough and sneezes. If you are wearing a mask when coughing or sneezing, put on a new, clean mask as soon as possible and wash your hands. If you are not wearing a mask, cover your mouth and nose with a tissue or use the inside of your elbow. Use tissues in the trash and immediately wash your hands with soap and water for at least 20 seconds. Or if soap and water are not available, use an alcohol-based hand sanitizer. Number 7. Monitor your health daily. Be alert for symptoms. Watch for fever, cough, shortness of breath, or other symptoms of COVID-19. Take your temperature if symptoms develop. Learn more about when to seek care and options for speaking with a caregiver. People who are mildly ill with COVID-19 are able to recover at home. Do not leave except to get medical care. Number 8. Follow safety guidelines when traveling. Delay travel until you are fully vaccinated. Check for travel restriction at your destination. Wear a face mask over your nose and mouth at the airport and on the airplane. Do not travel if you've been exposed to COVID-19, are sick, or if you test positive for COVID-19. Number 9. Prepare for your needs in case you will need to stay home for an extended period. Make sure you have enough groceries, household items, and medication, including over-the-counter medicines. on hand, and that you know how to order more either online or by making a phone call. And lastly, have a plan if you get sick. Talk to friends and family about who can help you if you get sick. Have a list of current medication available. Plan who could cook and deliver meals, run errands, and even take care of you. These are the top 10 ways you can help to reduce the spread of COVID-19. We are in this together, and we will get through this together.